All right, so good morning again. I'm Benitra Williams, Benefits Supervisor in the Office of Human Resources, and I will be delivering to you the 2016 Open Enrollment Benefit Information today. We have an agenda in which we'll cover the USG medical premium and plan changes, the new healthcare programs, dental, life insurance, disability. We'll go over how to enroll, as well as give you an opportunity to ask questions. All right, so for open enrollment, you have your HSA match, disability through MetLife, your life insurance options, as well as critical illness and whole life, which are Georgia Tech options, through UNA, lifestyle benefits, GT identity theft, and GT group legal. So this is your full comprehensive package outside of your core retirement. So for medical premium and plan changes, what we'll do through the presentation, primarily the presentation is only to identify the changes. So the benefits that you don't see, but they're still on that comprehensive list, just know this presentation is primarily only for changes, things that are changing in 2016. Okay, so health plan goals for 2016. Primarily, USG's message is to promote wellness and healthy living. Encourage you for your preventative care visits, biometric screenings, and education on overall well-being. So we know a lot of things that contribute to the rise in health plan costs are maybe lack of preventative health care visits. If you go for preventative health care visits, it prevents things from happening down the line. Biometric screenings, that's also something to look out for. We will have biometric screenings in the benefits fair this year. So you should have seen something in the Daily Digest. There's a link for you to reserve a spot online for your RSVP for biometric screenings. So again, this is more so just to promote wellness and healthy living to cut down in the rise in healthcare costs. They would like an increased participation in healthcare and health status through new tools and programs like the Castlight transparency tool, health coaching through Blue Cross Blue Shield of Georgia, as well as they have a future moms program through the Blue Cross plans. And we'll go over those three enhancements a little later in the presentation. There's also increased access to care through lower cost options and after-hour options. Okay, so medical plan changes for 2016. Real short slide. It's not a lot of changes to the medical plans. There's only one, and that's with the Consumer Choice HSA medical plan, where the family out-of-pocket maximum has, changed from $7,000 to $6,850 to comply with ACA requirements. That's the only plan design changed for all 4 medical plans. Okay? With the health savings account, the family contribution limit has increased from $6,650 to $6,750. So that's the most you can contribute over the calendar year, including the amount that Georgia Tech contributes. Okay? So those are only 2 plan changes, or really 1 change for plan design, but then the health savings account family contribution limit increased. All right, so the USG premiums and tiers. So as we continue to move forward to a defined contribution pricing model, USG contribution is the same regardless of plan chosen by the employee. So this year, yes, the rates have increased for your medical plans. The package that you all are looking at in the USG comparison guide, you may look on page, let's see, take a look here. The rates are on page 14. And if you take a look there, that's the same model that we've had over plenty of years. You see the employee-only contribution, then you see the employer contribution. And I'm looking at the employee-only tier right now. So if you take a look there, you see $399 is the amount USG contributes to the Consumer Choice HSA plan, $390 for the Comprehensive Care Plan, $395 for the Blue Choice HMO, and $325.82 for the Kaiser HMO plan. It's pretty much moving toward the defined contribution model. So this year, most of the employer contributions are closed. Next year, for 2017, that's where the USG, that's where they're moving the defined contribution. Meaning, for depending on which tier you're enrolled in, USG will only contribute that one defined contribution. So right now, looking at $399, $390, it could be maybe $400 is the defined contribution amount for employee-only plans next year. Okay? That's the model we're moving forward. Maybe for employee plus employee plus spouse, there'll be a different amount USG will contribute in a defined way. Okay? So that's where we're moving toward. That's where USG is moving toward in regards to the employer defined contribution for 2017. Okay? 2016, the amount that the medical plans increase, average increase of 6.7%. That's the average amount of the increase for 2016 benefits. This next slide here shows you the medical rates and how they've changed from 2015 moving to 2016. Okay? And this will also be in the summary guide that'll be mailed to your homes, and of course the 2016 rates you have in your hand, the USG comparison guide. Okay? I'll move forward here. FSAs, HSAs through US Bank. The 2016 employer match will continue. There's no change there. Again, I did say that that this presentation was only showing changes with certain things with dollar amounts. We chose to put it up here just to make sure you understand that they are staying the same. 2016 contribution limits, just as I discussed on the previous slide, the only thing that's changing is that the family is increasing to $6,750. FSA will be the same as last year, and you know FSA, the rule for FSA, you must re-enroll each year if you plan to participate in the FSA for that year. So if you don't want to make any changes during open enrollment, this is a passive open enrollment. So if you're not making any changes outside of FSA, you don't have to do anything, even with tobacco status. This is a passive open enrollment. You don't make any changes, your benefits will stay the same as they are this year, including your tobacco status, into 2016. All right? For those who are moving from an FSA to an HSA, example, if you're currently enrolled in the Blue Choice HMO plan and you're utilizing the flexible spending account through US Bank, you're moving to the Consumer Choice HSA medical plan for 2016. This rule applies to you if you plan to make contributions to the HSA plan. You're not allowed to contribute to an HSA with an active FSA. Even though your FSA may have ended December 31st, 2015, it's still active if you have a balance in it, okay? So employees, your balance must be $0 before January 2016 in your FSA, or neither employee or USG will be allowed to contribute to the health savings account until April 1st, 2016. Yes, ma'am.
Do you mean that if you're enrolling in HSA, you can only do that if you're picking consumer choice?
Okay, so our question is, if you're enrolling in the Consumer Choice HSA plan, does this rule only apply to the Consumer Choice HSA plan?
No, I'm asking if you are enrolling in HSA effective 2016, are your only options then to enroll in consumer choice?
Okay, so our question is your only medical plan option the Consumer Choice HSA plan if you plan to make contributions to a health savings account? That is true. The only way you can make a contribution to a health savings account is if you're enrolled in the Consumer Choice HSA medical plan. Okay? You have to be enrolled in the Consumer Choice HSA medical plan if you choose to participate with a health savings account. So if you're in
comprehensive care, then you can't enroll in HSA.
All right, so our question is, if you're enrolled in the comprehensive care plan, can you make contributions to an HSA? No, unfortunately, you cannot. You have to be enrolled in the Consumer Choice HSA plan if you would like a health savings account. If you're enrolled in any of the other three plans, you can enroll in the medical FSA, flexible spending account. Okay? Yes, ma'am.
Benidra, if you retire and you're not Medicare eligible, are you still able to participate in the FSA, or is that just for employed full-time people?
Okay, so the question is, if you're a non-Medicare eligible retiree, can you participate in the medical FSA, flexible spending account? The answer to that question is no, because you're retired, you're no longer an active employee. The benefit is pre-taxed, and if you're a retiree, you're no longer receiving a paycheck from USG. Good question. Anyone else on FSA, HSA, medical? All right, so we'll move on here. ID cards for Blue Cross Blue Shield of Georgia plan members. If you're not making any changes to your medical plan, no medical enrollment changes, you will not receive a new card. You will not. If you add a new dependent to your benefits, or you change within a Blue Cross Blue Shield, maybe you're going from consumer choice to comprehensive care, you will receive a new card. If you move from HMO plan to comprehensive care, you will receive a new insurance card. Any changes you make to medical, you will receive a new card for Blue Cross. But if you don't make any changes, no new card mail. And remember, on your Blue Choice medical card, your pharmacy information is already on there. Okay? So taking a look here, it has the USG, We Provide, You Decide logo, and it also has your pharmacy information on there. Okay. Kaiser. Due to Kaiser system updates, all Kaiser enrollees will receive a new card. So obviously, if you're a new enrollment, making changes to your Kaiser enrollment, you will receive a new card. Everyone will receive a new card, 2016 for Kaiser. All right. Tobacco surcharge. No increase in the surcharge amount. The amount remains at $75, only if you're considered a tobacco user, okay? Whatever your tobacco enrollment is, currently in 2015, it will roll forward just as is. So you don't have to, again, as a passive open enrollment, you do not have to go back in and change or update your tobacco enrollment. It will roll forward as is. Now, if anyone during the year, tobacco status change, and that's for either the employee or any of their dependents age 18 years old or older, so children and or spouse. If anything changes during the year outside of open enrollment, they should fill out the tobacco surcharge form and submit it to the benefits department. That change will take place the first of the month after submission of the form. Okay? Any questions on medical? There was only one plan design change and the rates increased. Yes, ma'am.
For the flexible spending account, last year there was a grace period to, if you hadn't used up all of your funds, you could do that by a date later than December 31st. Do you still have that for 2016?
All right, so our question is about the grace period that was introduced to USG schools last year. Yes, we do still have the grace period. Okay, grace period is still in effect, and grace period is just meaning that you have access. You're eligible to use the funds that you pledged in 2015 beyond the December 31st date.
Thank you. Okay,
use it beyond the December 31st date. I want to say that it's March 15th is the deadline to do so.
So we talked about the defined contribution. Are we going to have a defined provider list, or is that going to go to an open market of providers?
Okay, so your question is in regards to the moving toward the defined contribution model. And so will you have a choice of,
like we did.
Okay, so your options are 4 right now, 3 through Blue Choice and 1 through Kaiser. They have not spoken to that. I have heard questions about moving to an exchange like the retirees. And that has not been confirmed. That has not been confirmed for active employees. Good question. We have gotten that. Yes, ma'am?
Online, I was looking under comprehensive care, under the choices and so on, but there's nothing that shows up as comprehensive care. Is there some other name for that?
Great question. So you were looking for provider or care on BlueCrossBlueShield.com/DOR website,
Right.
and you were looking for comprehensive care. You were looking for the name, comprehensive care. Actually, it's the providers are listed by network, and that's the Open Access POS network. So you won't see those plan names, but it's by network because the Consumer Choice HSA medical plan as well as the comprehensive care plan both use the same network, Open Access.
So
Open
that's the
Access
name of it,
POS.
when you look it up, it's Open Access POS.
POS, correct.
How would you know that?
The networks, they should be listed.
No, I'm
Yeah, I
serious.
know.
There's
Totally.
nowhere
It's a good
online that
question.
says what
Yes.
comprehensive care is.
How could you know?
Yeah.
All right, so. I'm sorry, you have to give me a moment here. I'm not, for the sake of the presentation, I can circle back around with you, but it is the Open Access POS network. I'm not asking you with this document just yet to flip straight to it. I think, can you
I'm looking.
Okay.
I'll find it and show it to you.
Okay, okay, good deal. Any other questions on medical? Okay, we'll move forward here with the new programs for 2016. Blue Cross Blue Shield plans are now introducing Live Health Online. Only for the 3 plans listed here, the Comprehensive Care, Consumer Choice HSA, as well as Blue Choice HMO. So what exactly is Live Health? That you all may have been in situations where maybe you have deadlines to meet in the office, you're not feeling your best, you need to make a doctor's appointment, but you don't have time to do so. 2016, Live Health Online is being introduced, and this is where you can see a doctor 24/7 via any type of capable mobile device. It can be your iPad, it can be your cell phone. As long as you have capability, video capability, you can see a physician online in your office, at home, if you're in a baseball park and you step in your car. If you have video capability, you can do so at that time. Your child is sick, it's 3 o'clock in the morning, maybe you're the only parent at home that evening, the child needs to be seen, you can use Live Health Online. It's at a discounted rate as well. So as opposed to the applicable co-pays associated with the plans or the 100% contracted rate with the HSA plan, there's a $15 copay if you are enrolled in the comprehensive plan of the Blue Choice HMO. So that's less than your regular copay associated with those plans. So this is Live Health Online. When you sign up, for the Consumer Choice HSA plan, you have 100% of contracted rate. And that's the same thing with any visit you have prior to meeting your deductible if you're enrolled in the Consumer Choice HSA plan. Okay?
So, question. So my doctor's visits for that would be like $130, so I'd still pay $130 to do the online as well?
So it just depends. It just depends. So you're given a list of different providers. Some of those providers could charge, one may charge $130, the other one may charge $89 for that visit under the Consumer Choice HSA plan. So it depends on whatever their rate is, and if you choose them, you're given the opportunity to view the physician prior to clicking on their profile, so to speak. It gives you a little history, brief history about the physician you're choosing, where they're located, what state, what city, how long have they been practicing. You have that opportunity to do so out there, and that's what actually any of the 3 plans, but specifically speaking to your Consumer Choice HSA question, yes. All of the providers that you would use through Live Health Online are in network. You don't have to verify that they accept your insurance. They're all in network. Okay? Yes, ma'am.
Are they all boarded?
Are they all boarded? They're supposed to be. Yes, they are. Each person who signs up with, each physician who signs up with Live Health Online, yes, they are. Click on their profile and you should see they have different icons out there. So let me click to the next screen here. So this is information how you would go online. You go online, you sign up, you put in your information, your insurance information, your plan ID, your member ID. Put that information in your profile as well as payments. So it could be your HSA card through US Bank or your FSA medical card information. Put that information in there online. It's a perfectly secure website as well. All right? You sign up, you go online and you choose the doctor that you'd like to see. Look at their information, make sure that they're certified or meet your requirements of going to see a doctor, however you see and feel. And then you click on their profile, the consultation begins. The doctor, USG, they gave us an opportunity to test it out. We tested it out just as a group, just as we're set up here, and we chimed in and had a Live Health Online physician. She saw us, she's perfectly professional. She had on her white jacket. She even had her certification there up on the back wall that she was sitting in front of, had her laptop. She was able to speak with us verbally as well as to chat. Maybe you're having vocal issues that day and you can't speak. You had an opportunity to chat with her as well. Now, definitely for acute type issues, nothing like a laceration or anything like that, but acute type issues, you were able to call in and speak with the physician. You'll put your pharmacy information in the system when you're signing up. So if a prescription needs to be written, she sends it directly to the pharmacy of your choice. Applicable copays would apply there based on the plan that you're enrolled in. Your copays or 100% contracted rate prior to deductible under the HSA plan. Yes, ma'am?
Is this basically a Skype call? Is it
Is this a Skype call? Yes, if you have video conferencing abilities on any type of mobile device, your cell phone or iPad, it is. It's not Skype itself. Live Health Online, they have their own application.
So what do we have to have on our end?
I'm sorry?
What do we have to have on our end?
What do you have to have on your end?
Right.
Nothing. As long as you have a cell phone that has video capabilities, you have a camera. You have a camera on your cell phone or your iPad. Same way you're on Skype with someone and they can see you, you can see them. As long as you have those type capabilities on your device, then you can use Live Health Online. Great question.
So obviously they'll prescribe prescriptions if they feel comfortable, but if they need lab work and stuff, well then they send you to a lab and then you do lab work and then you get back with them too?
Great question. So she's stating that you're questioning if you need lab work, what happens then? Then they would actually, if you need lab work or something like that, now they'll tell you whether or not they're able to, diagnose whatever your issue is that you're calling in about. But if you need lab work, typically they'll tell you to follow up with your PCP, your doctor of choice. That's who you will follow up with to get that type work done.
They won't send you to like a lab, just write a prescription, go to lab?
No.
Okay.
No. Will they write you a prescription just to go to a lab? No, because they want you to follow up with your family doctor.
Just wondering how far it's going.
Great question, great question. Yes, ma'am?
So let's just say we had a semi-successful conference call with the doctor, and they said, follow up with your PCP. I've already paid $15 for them. I'm going to go to my PCP and pay another copay?
Well, okay, so your question is if a doctor states you've had a consultation with the doctor, you paid your copay, he or she is telling you to follow up with your PCP. Okay, so in that situation, in my example, she's diagnosed you. You had a cold. You had a sinus infection. She sent you your information over, your generic antibiotic over to your pharmacy. You're done. You're okay with that. But if she sees and feels okay in 2 weeks, you won't come back and see her. You'll go back and see your primary care physician. Mm-hmm. Not saying that when you had the consultation, nothing was resolved, and then you go back and pay. If they cannot diagnose you, your copay, the price or the charge, it's null and void. If they cannot diagnose you of what's going on and they feel comfortable in saying, I'm sorry, this is beyond my expertise or beyond this call, this live health call, then yes, you should go to the emergency room or your PCP. Then they will refund if anything has been charged, obviously, yes. They'll refund that money, and then you'll go to wherever they tell you to go, be it ER or your PCP. Mm-hmm. Great question. We got the same questions as well. Yes, ma'am?
Denitra, backpedaling just a tiny bit. I forgot to ask this question about the flexible spending accounts. A lot of doctors are going to concierge services. Mine has gone to a concierge service, and to be able to continue seeing her, I have to pay $16.50 a year. Is this something that you could pay for with your FSA?
Okay, so her question is, her doctor is now going to a concierge type suite or boutique style physicians. Can she use her FSA dollars to pay for the overhead price? Unfortunately not, okay? That's on the list of approved eligible and non-eligible items of US Bank. Paying those overhead fees just for the convenience of being in a boutique style doctor's office, those are not eligible expenses under the HSA or FSA. Great question. We've gotten that over the past years as well. All right, so any other questions here on Live Health? All right, CBS Minute Clinic program, the 3 plans that gives you this benefit, discounted benefit, comprehensive care, consumer choice HSA, and the Blue Choice HMO plan. So, you know, if you all are going to maybe Walgreens, you know, they have their little clinic there on the side of the pharmacy. Your PCP, obviously, urgent care, these are all places that you can visit to be seen if you have a medical issue. What CBS has done, you know, CBS is our pharmacy benefit manager for our pharmacy for Blue Cross Blue Shield plans. And so with the CBS stores, CBS is now giving USG medical plan members a discounted rate to be seen at the CBS Minute Clinic. You can still have your prescriptions filled at Kroger, Walmart, Walgreens, but if you use a CBS Minute Clinic, you have a discounted rate as opposed to the regular rate, which is a $15 copay. So that's less than your copay, once again, for your PCP or your regular family doctor. So it's discounted here. Yes, ma'am?
Is that true if you're traveling to out of state?
Her question is that true as well if you're traveling out of state? We have not had that question just yet. Yeah, that is a good question. We have not had that question just yet. Maybe that's something that we can put out on our website for Q&As. Athena?
Yes.
Thank you. Okay, so the members enrolled in the Consumer Choice Plan, the Blue Choice HMO plan, $15 copay there. Members enrolled in the Consumer Choice HSA plan, you'll still pay 100% of the cost prior to meeting your deductible. Okay? All right. Other new programs for 2016, specialty drugs. There's a couple of things you need to know about specialty drugs if you are a member who uses specialty drugs that are considered specialty drugs through CVS. So there's a new formulary each year, so some medications have dropped off. We do have, or discontinued there, we do have a list, with USG, they have a list of the new formulary for 2016. So if you are one, again, who uses specialty drugs, you will want to check the listing to make sure your drug is not one that was discontinued. Now, on a quarterly basis, the medications, the specialty formula, just period, the formulary changes as far as the medication switching tiers. Okay, so maybe it can go from generic to brand name or vice versa. So those are some things to look for as you approach the new year, as well as quarterly throughout the year. All right. Those members who the drug changes who are affected, they will be notified directly by CBS as well. They will be notified by CBS as well. All right, knowing your resources, Castlight. So for those employees who are enrolled in the Blue Cross Blue Shield plans that have deductibles, so that's the comprehensive care plan and the consumer choice HSA plan. You give an opportunity to shop around for different prices. So those who are in the comprehensive care plan, you know, you pay a copay for your regular doctor's office visits as well as your specialty doctor's office visits. Now, if you experience maybe you have to have outpatient surgery, you know, there aren't any copays associated with things like outpatient surgery. You have to pay so much, you have to pay your deductible, you have to meet it, and then Blue Cross Blue Shield will start paying a certain percentage of that actual visit, that medical service. Well, using Castlight, say if you need an MRI, you visit the Castlight website and you'll take a look at different doctors in any area. So maybe you're putting in your demographical information, and you're putting in your zip code as your home zip code. Well, it'll look around, it'll show you Dr. Tracy is charging $83 for his MRI, Dr. Williams is charging $77, and then Dr. Matthews is charging $134. The stars there at the bottom is telling you how their quality, how they're rated against those who have actually used this service. So you can take a look out there and shop around for the best price. All right? Yes, ma'am.
Are all the doctors shown on this in network?
The doctors shown on this are in network. You're logging in Castlight. Castlight is associated with Blue Cross Blue Shield of Georgia. Okay? So when you put in your information, your plan ID, because you can also log in using your Blue Cross Blue Shield of Georgia member access.
Okay.
You can access it that way, so it has all of your plan information in there. Good question. Yes,
So
ma'am?
even if your PCP recommends you see someone in particular, you're suggesting that we look online to get the best price rather than going with someone our doctor recommends?
Okay, so your question is, even if you have a PCP, should you go out here and shop around? PCPs are associated with the HMO medical plan. The HMO medical plan doesn't have a deductible to be met or anything like that. HMO plans are they're solid basis based on copays only. So each service you have has a copay. There's no shopping around with the HMO plan. Only with the two plans that which have deductibles. And that's the Consumer Choice HSA and the Comprehensive Care Plan. Great question. There's someone over here. All right, so this is Castlight, just another resource you can use. All right, Castlight information here, just as I described, you can either use Castlight.com, you can use the Castlight.com/USG to log in, or your Blue Cross Blue Shield GA user member access. All right. Personal health consultants by Blue Cross Blue Shield. So they have registered nurses that are on site there at Blue Cross Blue Shield, and if you have some type of medical condition that requires condition type care, maybe every once a month visit or every 2 months, it could be diabetes, it could be a heart issue. They take a look, they as in Blue Cross Blue Shield of Georgia, they take a look at your record and see exactly how often you're going to these visits. And if they feel that it meets their condition care program, a registered nurse will reach out to you. He or she may give you tips. And it may be something that your doctor has already shared with you. It may be something outside of your doctor's advice that they're eluding, giving you more information on. Maybe it could be going for walks in the park, or just maybe things, how to cook better based on your condition. They give you, again, just advice to help you along your way with your condition. Okay? Typically, they may call and leave a message and have you call them back. You can communicate with them either way. Either take care of the visit while you're on the phone, whenever they call, or else return their phone message. We get some calls in the GT Benefits office like, is this true? Is this real? Everyone's worried about identity, which I do understand that, but just know you can always call Blue Cross Blue Shield directly. If someone has not reached out to you and you would like assistance, then you can once again call Blue Cross Blue Shield to get that assistance to enroll in the program. No extra charge or anything like that. Next up is Future Moms program through Blue Cross Blue Shield. Same thing, condition care. Now you have a new medical condition. The doctors and registered nurses may offer you advice that it has not been spoken about maybe with you and your doctor, but it gives you 24-hour access to a registered nurse maybe when your doctor isn't available, 3 o'clock in the morning, and you're having a situation, okay? So touch points for your telephonic outreach, health risk assessments for depression or early delivery, as well as free educational materials, okay? All right, so that's it on the medical. As far as new resources, rates, FSAs, tobacco surcharges, that's it for the medical. Dental, there are no changes in the actual plans for 2016, right? The plan design. However, the rates for the Delta Dental Base and the Delta Dental High plan have increased by 12%. And I believe that's in your books on page 20.
What
You'll
percent
see
was that?
12.
12?
12%, I'm sorry, I didn't hear that. 12% increase, okay? So this slide here is just showing you the rates, but again, they are in the booklets that you have today on page 20. The HMO, the Georgia Tech Delta Dental HMO plan has not changed. The rates have not increased. And these rates have stayed the same over the past 3 years. Okay? But just FYI on the dental. That's the only change there. Just the rates have increased. Okay? Life insurance and disability. Your life insurance, USG life insurance, is through Minnesota Life. There are no changes here, but we like to go over the life insurance rules annually just so everyone likes to know what they can and can't do with life insurance. So we all know the basic life insurance policy is at no cost to you, $25,000, both term life and AD&D grouped together. No cost to you, $25,000. Only thing we would like for you to do, even if you do not have the supplemental life insurance, is to log on to TechWorks and confirm your beneficiaries. Okay? If you're not making any other changes during open enrollment, please log into TechWorks and confirm your beneficiaries. Supplemental life options, employee coverage, spouse coverage, child, as well as the AD&D standalone plan. The rules for supplemental employee life insurance, the maximum of the lesser of 2.5 million or 8 times your salary, whichever is the lesser of the two. You can enroll in multiples of your salary, and the rates are age banded. So it's based off of your age, your date of birth, as well as your salary, as far as how much you pay. If you go into TechWorks and you're enrolling, during your open enrollment, you'll see the ease of enrolling in it because it already has your multiples of salary up to the maximum amount, and the rates are out to the right. Okay. New enrollments, so if you're currently not enrolled in Minnesota Supplemental Life, you can enroll in one increment of your salary during open enrollment and not have to complete the evidence of insurability, the medical questionnaire. You can enroll in one time if you're newly eligible and you've never had it before, one increment. If you're already enrolled in Employee Supplemental Life and you'd like to increase one level during open enrollment, one increment of your salary you can increase during open enrollment without completing an evidence of insurability. Okay, anything more than one bump, then you would be subject to evidence of insurability, and we'll send that information on to Minnesota Life for approval. Once you're approved, then we will make the benefit effective the first of the month after we receive approval. You'll receive approval, the decision made by Minnesota Life, but once we receive the approval, we'll put it in the system effective the first of the month after approval. Once again, if you bump up twice, you're still only given the one bump that is not subject to evidence of insurability, while the second increment increase is subject to EOI.
So if you're already at 3x and want to go to 4x, you can do that without evidence of insurability?
Correct. So if you're already at 3x, 3 times your salary, and you want to increase to 4 times your salary, yes, you are allowed to do so without evidence of insurability. Correct.
And so each year you'll be able to bump up one bump? Like if I was at 3 and I bumped up to 4 this year, I could do 5 next year?
Okay, so the question is, will you always be allowed to increase by 1 times your salary without evidence of insurability? USG, they make the rules. It can change from year to year.
Okay.
But this year, you are allowed to increase by 1 salary increment. Great question.
Okay, if you already have the supplemental life insurance and you retire during the plan year, are you still able to keep it, or do you have to go through some hoops to be able to keep supplemental life?
Okay, so the question is, if I retire through the year, well, say I have supplemental life insurance right now. Say I retire next year, April 2016. Can I keep my supplemental life insurance? Yes, you can keep your supplemental life insurance, but what about the amount? What amount am I able to keep? The amount is based on, USG has rules based on when you actually came to USG, you started working for USG, they have rules set up already. So that is the determinant as far as the amount that you keep. So the rules are embedded. I can't quote those rules right now. We have to look at it at that time. But your supplemental life insurance, it does decrease at the time of retirement, but it's just based on the time that you started with USG as far as what amount you're able to keep. Great question.
And so where do I look this up?
It's out on the usg.edu website, as well as I believe we have a link from our website, ohr.guytech.edu. You click on benefits and retirement. We have links out to USG's website in regards to retirement, life insurance, how much you're able to keep.
Okay, the retirement counselor would be able to have this information for you as well, correct?
Yes, ma'am. We cover that information during your retirement exit interview. Yes, ma'am. Sure do. Yes, ma'am.
On page 22, it says voluntary VAD&D. What does the VAD&D stand for? What does the V stand for?
Okay, you're speaking of AD&D?
Well, it says voluntary VAD&D. What does V stand for?
Okay, I'm sorry, you're on page 22, and you see VA.
Where it says family plan.
Okay, I see it there. That's for voluntary AD&D, voluntary accidental death and dismemberment. Okay. So all of our plans are a la carte, all of our plans are voluntary. That's just the way they're coding it there on the book, voluntary AD&D, accidental death and dismemberment. Okay? So here we have our spouse life coverage, the rules around increasing or enrolling for the first time for spouse life insurance. Any new enrollments for spouse life require evidence of insurability. If you decide to increase, any increase requires evidence of insurability. So be it new enrollment or any changes other than decreasing, they are subject to evidence of insurability. Okay? That's spouse life. And just know spouse life, the rate is actually based off of the spouse's date of birth. Okay? So not yours, but your spouse. Child life, no evidence of insurability is required, be it first time enrollment or increase, decrease, no EOI required there for child life. One nice thing there about the child life, be it you have one child or you have 6 children, the amount of life insurance you select, each child under age 26 will have their own separate life insurance policy. So if you're choosing $15,000, you have 6 children, each one will have individually will have a $15,000 life insurance policy. Okay, just for one rate. Okay. Disability, short and long-term disability. It's through MetLife, it's the vendor. Any new first-time enrollees, your enrollment will be subject to evidence of insurability. Okay? First-time enrollments and short-term disability is subject to evidence of insurability.
Even for new employees? New employees?
His question is, if you're a new employee, would they have to submit evidence of insurability? Yes, they would. As a new hire, you're given the opportunity to enroll in short-term disability without EOI. Okay, so going through open enrollment, if you waive your eligibility or your opportunity at that time, you're newly hired, you wait until open enrollment, yes, it's subject to evidence of insurability. Okay. The long-term disability rate has increased. It's increased by 15% for 2016. New enrollment into long-term disability, it's not subject to EOI, evidence of insurability. It's not because it's already embedded in the plan. There's a 312 rule. Excuse me, there's a 312 rule as far as if you experience a situation, be it 3 months prior to enrollment in the plan, and you submit, then you have to go free and clear for 12 months before that particular situation can be paid out by MetLife. So that's already embedded into the plan. So if you wanted to enroll in the plan during open enrollment, no EOI for long-term disability, but the rate has increased. Here at the bottom, it gives you an idea of the rate calculation. So say if your annual salary is $56,000 annually, the amount you would pay per month is $10.45. That's currently. For 2016, you're making the same salary. The rate for this person has increased by $2. It's $12.04 for 2016. So that's the increase. It increased by 15%. All right. How to enroll. So here at Georgia Tech, your enrollments all take place through TechWorks. You go out to TechWorks, you will see an open enrollment event there for you to go through. We want you to first check your tobacco status. Just if you want to take a look out there at your tobacco status, you can add dependents. If you need to add new dependents and maybe change some of your dependents, the information out there, we would like to receive a social security number based on new ACA requirements for various things that we do in HR. We need dependent social security numbers. If your dependent is missing a social security number, you probably will receive a communication from OHR to remind you to go out and update your dependent social security numbers. Okay. As we said earlier, FSA, you must re-enroll each year. So if you intend on having an FSA for 2016, you have to go back out and re-enroll in it during open enrollment. Update beneficiaries. We touched on that earlier as well. So if you have both dependent life, supplemental life, as well as basic life, I want you to go out and take a look at your beneficiaries as well. Donated sick leave. This is the only time of the year that you can donate sick leave hours to the Georgia Tech sick leave pool. Now, if you're retiring next year, 2016, maybe you have ORP as your retirement. You're enrolled with one of the three, Valley, Fidelity, or TIA-CREF, and you have maybe 400 hours of sick time. You want to donate it then in April when you intend to retire. Unfortunately, you cannot at that time. The only time you can donate hours to the Georgia Tech sick leave pool is during open enrollment. You'll see that on your first page when you log into TechWorks and access your open enrollment event. Yes, ma'am.
Oh, Benitra, there's a rumor running around in my building that you can only use donated sick leave if you've donated. Is that true?
So you're asking me if you can apply for donated sick leave hours if you've never donated sick leave hours.
Right.
That rumor is not true. You can apply for the sick leave hours from the donated sick leave pool, even if you have not contributed hours. It's set before a committee outside of OHR is a committee. They review the request and they approve, it's based on the approval from the committee. Good question. Yes, ma'am?
Is there a tax benefit for donating sick leave?
Is there a tax benefit for donating sick leave? No, there's no tax benefit for donating sick leave. No tax benefit. There's sick hours from University System of Georgia, so it's just transferring hours from your bank to the donated sick leave pool bank. There's no track record or anything like that.
Yeah, because it's not like vacation. You don't get paid out for sick leave when you leave. But vacation you do, so that's an actual monetary benefit.
Vacation is a monetary benefit. Good question.
Can you designate your sick time to a specific person, or does it all go to a pool?
Great question. Can you designate your sick time to a specific person? Someone you know on campus, and whomever, can I donate my sick leave to George Burdell? Unfortunately, you cannot. Your request goes to a committee. The committee approves that request. You have no idea who's using the hours or requesting hours from the sick leave pool. Good question.
For short-term disability or long-term disability, do you have to use all your approved sick time before that kicks in?
Your question is about for short-term disability or long-term disability, do you have to use your vacation and or sick time in order to be paid out from MetLife? That's your question? Okay, no, you don't have to, excuse me, Athena.
You have, excuse me.
Joe.
For short-term disability, you're required to use your sick time during the elimination period, which is 14 calendar days. Once the elimination period is over, at that point, if you want short-term disability, you only receive the short-term disability. Whatever sick time you have left over stays in your accruals.
Thank you, Athena. And so the answer was during the elimination period. That's when you would use your vacation and/or sick time there. And then once your 14-day elimination period for short-term disability or your 90-day for long-term disability, that's when MetLife will pay you out your 60% of your salary while out on disability. Great. Thank you, Athena.
You're welcome.
What is the rule about using sick time to add to your time of service for retirement or possibly using vacation? Okay,
so the question is, what is the rule in regards to sick time using, if you're a TRS member, what's the rule about using your sick time? Sick time that you have, TRS, they have a calculator. It's so many hours that you can donate that will compensate for 1 year of service, creditable service. So maybe if you've been here, you've been within USG for 20 years. You have so many hours of sick time. TRS, they convert those hours of sick time, those that meet that the actual conversion. You may have about 2 years of credible service used up, that TRS will accept for that sick time. So many years, I want to say it's 344 hours for some reason, that is equivalent to 1 year creditable service. Okay, but that information is also out in the policy as well for the actual conversion. Okay. For the sake of time and recording, let me go ahead and get through this here, and then we'll open the floor for more questions. Okay. So elections outside of TechWorks, you have 2 options: Unum, whole life, and critical illness. You call the 1-800 number, 1-800-471-4131 to enroll. You have to speak with a licensed representative. And most often people are wondering, okay, what's the difference between whole life, critical illness, and what's offered through USG? So the whole life, the Minnesota life is just a term life policy. Term life policy, which includes AD&D. Whole life, and which increases based on your age and salary. Whole life, you lock in the rate. It's permanent whole life. So whatever rate that you lock in at the time of enrollment, it never increases. It's also portable. All of the policies are portable, but it's good to know that whole life and critical illness are as well. Critical illness is like a terminal type illness. Once you're diagnosed, maybe I'm a cancer. Some people maybe use the policy for cancer. Once you're diagnosed with a terminal illness, then whatever you took the policy out for, the amount, that's what you'll be paid out at the time of diagnosis. And again, these 2 policies are through Unum. Unum is the vendor here. You also have USG perks, although it doesn't require an actual election through TechWorks. It is available for USG employees who are receiving a check from USG, from Georgia Tech. We like to ask for each and every employee, once you go through TechWorks, even if you're not making any changes, it's always good to print a confirmation statement. That's your confirmation of benefits, right? It's always good to have that information on hand at any point in time, just in case something happens. So go through, check out your beneficiaries, donated sick leave, all of that through TechWorks, and print your confirmation statement at the end. Family status changes during open enrollment. So you have the opportunity to make family status changes throughout the year. That could be you've gotten married, you've gotten divorced, you've had a baby. You have 30 days to notify the Office of Human Resources of your change in family status. So if you've had a baby and it's November, you want to make sure you get that baby added now in 2015. Don't make the change during open enrollment. You get married, you want to do it in 2015. Don't do it during open enrollment. So by all means, just reach out to the benefits team and we can walk you through that process. Okay? 2016 Open Enrollment Administration by USG. So all changes must be made during the open enrollment dates, which are November 2nd through the 13th via TechWorks. There are no open enrollment exceptions or anything like that. These are directions that we have received from the University System of Georgia. So if you have changes you need to make for 2016 or new enrollment you'd like to make, do so through TechWorks between the dates of November 2nd through November 13th. Just as I stated, about printing your confirmation statement, if something happens, maybe there's a system glitch. We know technology isn't always smarter than humans and paper, but if you have a confirmation statement and we notice that there is a problem or something did happen with your election, that's the best way we can confirm and go back and make sure we have a correction. We can make the correction for you. Remember, tobacco surcharge, if you're not, or maybe if you need to make a change for 2016 outside of open enrollment, maybe you checked, yes, I am a tobacco user by mistake through open enrollment. You will be charged that first month, the month of January. There are no refunds. But if you need to make a change to correct that in the new year, you submit the form to us, to the GT Benefits Office, and we'll make the correction the first of the month thereafter. Okay? Ways to get assistance. So we have the Georgia Tech Benefits Fair next Wednesday, students in a ballroom from 10 a.m. to 2 p.m. That's the benefits fair. We'll have all the vendors there, right? If you're not able to attend the Georgia Tech Benefits Fair, USG has a calendar of all University System of Georgia benefits fairs. So if you're able or you need to, you miss hours here at Georgia Tech, you can attend another campus benefits fair. That's perfectly fine, and the dates are out there on the USG website. If you go onto our open enrollment website, you'll have links to link you back to USG's website. Okay, review your Georgia Tech and USG open enrollment materials, and the website is listed there. So again, today you all have the USG comparison guide in your hand, and this is typically the booklet that we give to our new hires when they come through the door. But you all should receive your mailing if you have not already. It's in an envelope that looks like this to your home. It's smaller than the booklet that you're looking at right now. It's about 8 pages, but it summarizes all of the changes for 2016. You have a cover letter in there, gives you some directions of different things to do during open enrollment, sites to visit. So that information is coming if you have not received it already. Okay. New this year, we've always given you the 404-894 GTHR number. That's the Georgia Tech Office of Human Resources number. But new this year, we've partnered with the USG Shared Services Center. So for the past 2 or 3 years, University System of Georgia has a call center located out in Sandersville, Georgia, that accepts open enrollment calls from, for maybe about 28 institutions. Georgia Tech, we're not on the same HRS platform, Human Resource Information System platform, so we typically handle our calls in-house. But this year, we've partnered with Shared Services Centers that they will be accepting our calls. They are directly associated and communicate directly with Georgia Tech Benefits Office on a daily basis, so they know about our Georgia Tech specific benefits and all. So they're able to assist active employees as well as retirees during the open enrollment time period. Okay? They also have special hours, so for the first time, we'll have Saturday hours. That Saturday, November 7th, they'll be open from 9 a.m. to 1 p.m. to accept your calls over the weekend. The last 2 days of open enrollment, they're open until 8 p.m. So that's those two extensions are a great addition this year for Georgia Tech open enrollment. So by all means, if you need assistance, feel free to call the 800, the GTHR number, and you'll be transferred out to the Shared Services Center. There's also an open enrollment email, so if you have any questions, feel free to email openenrollment@ohr.gatech.edu. Right? So these are the ways that you would get assistance during open enrollment. This concludes the open enrollment information session. So we'll open the floor up now for any questions you all may have. I know you had it earlier. Go ahead.
I'm assuming there weren't any changes to the vision as far as coverage or anything, which is why you didn't mention it.
So her question is, were there any changes to the vision insurance? No, there were not. No, ma'am, no changes. Rates stayed the same, plan design is still the same. Yes, ma'am, back off.
My question is about beneficiaries. When I check for my beneficiaries for my life insurance and stuff, it still has names that I listed years ago.
Okay.
How do I delete or get those removed or they stay on your record forever, or how do you?
Great question. So she's looking out, she wants to confirm her beneficiaries that are in the system, and she sees that she has old beneficiaries, dated beneficiaries that are in the system. How does she remove them? The answer is you cannot remove them. They're there for record-keeping purposes. So even if that beneficiary was your beneficiary 8 years ago, they're not any longer, they don't have an allocation or anything. They're just listed for record-keeping purposes. Great question. Yes, ma'am?
The slide didn't say, what time is the benefits fair beginning and end?
Oh, I mentioned it, 10 to 2.
Oh, perfect, thank you.
10 a.m. to 2 p.m. for the benefits fair. Right. Yes, ma'am?
So I have a question. The Blue Cross Blue Shield POS is considered the comprehensive care? Is that what it's under?
I'm sorry, say that again.
The Blue Cross Blue Shield POS, that's what I currently have. Is that considered comprehensive care?
Yes,
Okay.
yes, sir. The question is the Blue Cross POS, Open Access POS plan, is that the comprehensive care plan? Yes, it is.
Okay.
Yes, it is.
Thank you.
Good, you're welcome. Anyone else?
I do.
This presentation will be available on our website, the audio as well as the presentation. Okay, okay.
I'd like to know.
All right, any other questions? All right, well, we thank you all for coming out. Thank you, thank you, thank you.